the unexpected consequences. For the prostate in older men who regularly engage in private relief, many men aged 40 and above continue to masturbate frequently. Some individuals maintain that this practice supports physical well-being, enhances sleep quality, and may even act as a preventative measure against prostate enlargement. However, concerns remain among others. Could daily masturbation be detrimental? Might it disturb hormonal equilibrium or subtly harm the prostate? At first glance, this question appears straightforward, yet it masks an intricate interplay of physiological processes often overlooked. The prostate is a small gland located directly below the bladder. Its chief function is to produce the fluid that sustains sperm. Despite its modest size, comparable to that of a walnut, the prostate plays a decisive role in sexual activity, urinary health, and general comfort in the pelvic region. If not adequately cared for, this gland can become congested, inflamed, or enlarged over time. This discussion will examine 3 particular changes that the prostate may undergo as a result of daily masturbation. The following analysis is grounded in established biological principles and corroborated by genuine clinical observation. The third change, when properly understood, can serve to prevent problems that are often not recognized until it is unfortunately too late. For those in their 40s, 50s, or older, it is important to remain updated with comprehensive information on men's health. If questions arise regarding this subject matter, sharing them is encouraged, as some open dialogue often benefits others with similar concerns. To address this topic with accuracy, it is insufficient to rely upon intuition or subjective belief. An objective examination of bodily processes is necessary, focusing particularly on 3 principal biological mechanisms that are influenced when the habit is sustained on a daily basis. 3 biological mechanisms affected by daily masturbation. It is often queried: if daily masturbation truly poses negative consequences, why does the body continue to desire it so consistently, as if it were an innate reflex? The answer lies in the physiological, not emotional, response of the prostate. Upon reaching orgasm, a man's concentration of DHT, dihydrotestosterone, in the bloodstream temporarily decreases, and DHT is a potent androgen that preserves male characteristics, but when present in high and persistent levels also contributes to the enlargement of the prostate. Regular ejaculation results in brief hormonal reprieves, lessening continuous DHT stimulation of the prostate. However, if undertaken with excessive frequency, perpetual hormonal fluctuations might destabilize the endocrine system and interfere with the body's natural testosterone production, particularly for men nearing andropause. Aside from hormonal factors, ejaculation is accompanied by contractions of the pelvic floor muscles as well as the prostate itself. These muscular movements help improve regional blood circulation, stimulate metabolism, cleanse tissues, and nourish the gland. Optimal circulation assists in maintaining the prostate's elasticity and prevents tissue stiffening with age. Yet excessive stimulation of the pelvic muscles without adequate rest can result in tension, fatigue, and diminished urinary control, particularly in the aging population. Furthermore, the prostate contains a highly specialized local immune function. Normally, waste materials such as dead cells, surplus proteins, and other biological debris is partially expelled through ejaculation. This process reduces the risk of chronic low-grade inflammation. However, insufficient recovery time between ejaculations can disrupt these immune mechanisms, leading to persistent low-level irritation of prostate tissue. This may result in a sensation of heaviness in the pelvic area, even if diagnostic tests reveal no clear cause. Although these biological mechanisms may seem technical or abstract, their impact is vivid in clinical practice. Many individuals maintain a regular pattern and experience stable health. Others, however, neglect these bodily needs and consequently suffer prolonged uncomfortable symptoms. A case study, one example illustrating the effects of such habits, involves a patient, herein referred to as David, age 60, previously employed as a supervisor in construction. He presented with frequent nocturnal urination, an ongoing sensation of an incomplete bladder emptying, and a dull discomfort in his lower abdomen, despite a history of the good health. He reported feeling out of sorts in recent years. On further questioning, he disclosed that he had abstained from all forms of ejaculation for nearly a decade, believing that after the age of 55, such matters were of little significance. He also felt considerable embarrassment discussing this matter, viewing it as overly private. After a physical examination and prostate ultrasound, mild enlargement was detected, with PSA levels exceeding normal parameters and visible glandular irregularities. Although not immediately severe, the findings indicated that the prostate had reacted to years of neglect. Small adjustments were recommended to his routine: an increase in light physical activity, enhanced water consumption, selected supplements to support prostate function, and, crucially, the reintroduction of ejaculation 1 to 2 times per week, according to personal comfort. After approximately 4 months, David's PSA levels had decreased slightly, the frequency of nocturnal urination improved greatly, and the heaviness in his abdomen had almost vanished. Furthermore, his confidence and willingness to discuss sexual health had measurably increased. As he remarked, he had never imagined that such a simple measure could exert such a profound influence on both body and mind. Such cases are not isolated. Many men aged between 50 and 70 find themselves in similar circumstances, either neglecting their bodies or uncertain about the ideal frequency for such activity. Recommended frequency by age group. A frequent question is, how often should one masturbate each week? The answer is not universally fixed. It varies depending upon age, overall health, and an individual's capacity to recover after each instance. Based on clinical findings and guidance from urological experts, the following general recommendations may be offered. Men aged 40-something, 49, 3 to 4 times weekly is generally acceptable, as hormonal levels remain robust and the prostate typically recovers efficiently. Men aged 50 to 59 reduce frequency to 2 to 3 times weekly, adjusting in response to feelings of fatigue or symptoms such as difficulty urinating. Men aged 60 and above, once weekly is usually sufficient to support circulation and maintain glandular health. If in excellent health, with continued libido, twice weekly may be suitable, but Avoid excessive sessions. The principal ideal is consistency, avoiding overly long intervals without activity, but equally refraining from exceeding the body's natural capacity for recovery. This practice should be complemented by appropriate rest, a nutritious diet, moderate physical exercise, and regular medical assessments to ensure holistic health. Importantly, it is not necessary to adhere strictly to a numeric guideline. The focus should be on self-awareness and adjusting routines as required for each stage of life. The psychological aspect, in addition to physical factors, there remains a significant psychological barrier that deters many men from properly attending to their prostate health. Masturbation after the age of 50 carries undue stigma, prompted by societal and cultural attitudes, leading some men to neglect this aspect of well-being. Consequently, many acquaintances who sensed a problem hesitated to seek advice, perceiving older age ejaculation as irrelevant or inappropriate, particularly when undertaken in private. However, upon realization that this is simply an element of proper male health maintenance, no different from a regular exercise or timely meals, attitudes improved substantially with tangible benefits observed. Key takeaways. Ultimately, it is hoped that the essential message is not confined to a numeric recommendation or a trivial health tip, but rather an increased awareness. The prostate should not be disregarded due to discomfort or embarrassment. Instead, it requires regular attention, commensurate with any other vital organ. Self-care is not exclusive to youth. It is for all who value their health and strive to maintain it throughout life.